Okay, so we reached our 10-minute max. I should be better about monitoring this, but okay. So back at it. After menopause, we do one of the things is, we're females are lower in the hormones that they're producing, and one of those side effects can be bone loss. So if we give them an estrogen hormone replacement therapy or an EHT, we can actually prevent bone loss. So Premarin, Estrace, Estratest, these are good ways to help patients avoid osteoporosis, especially in the female population. Analgesics, these are pain relievers. They can either be that narcotic, so Demerol, morphine. I've seen different C2s prescribed specifically for arthritis pain, or we can have non-narcotics, so Tylenol, aspirin, ibuprofen. Really, anything that's a non-narcotic analgesic is going to be a NSAID or a COX-2 inhibitor too. Um, there are different strengths of it, and we can have prescription strength or we can just have over-the-counter strength. But again, analgesics relieve pain. Okay, so the next thing that we have, so anti-tumor necrosis factor, those anti-TNF drugs, these are super expensive because they're biologics, but they are going to slow or stop the destruction of the joints by disrupting tumor necrosis factor, TNF. Basically, it's going to slow or stop joint destruction. Really important for rheumatoid arthritis. Okay, and then gout treatment. Gout can be treated with a uric acid reducer. So Xyloprim, probenecid, these are our gout treatments. It's going to essentially take that uric acid out of the joint space. Okay, so Fosamax and Bonavia, these are anti-reabsorptive agents. These decrease the removal of calcium from the bone. So it's actually going to stop calcium from coming out of our bone. So the anti-reabsorptive agents are great for patients with osteoporosis. Other treatment options, so with fractures, we see a lot of casting and splinting. Casts or splints are protective coverings for the site of fractures or dislocations. What they do is they immobilize the injured area to keep the bone in alignment and protected while healing. This right here is a cast. This is a splint. Okay, so next we have traction. Traction is the process of drawing or pulling on the bones or muscles to relieve displacement and facilitate healing. It creates a temporary space between vertebral bones to relieve pressure and decrease cervical and lumbar pain. So here, this is what looks like a physical therapist using a machine to perform traction. And this is kind of cool. I don't know if I can make it big. I'm sorry. Okay. So again, that traction is going to increase that temporary space between vertebral bones, and it's going to relieve pressure and decrease that cervical and lumbar pain. Okay, so I'm going to go ahead and stop there. I'll upload a little bit more later today. I will actually try to record this as I'm lecturing, so you're not missing any of the awesome student questions that I get. Again, I hope you feel better, and I will see you next week.